Facebook. And Neil's like, are you on YouTube and Facebook? Now we are. I forgot to hit the button.
All right, let me check again on it.
I couldn't find Neil because I was on the streams, not the studio. Then I'm in the studio and forget to hit the go live button. So the good news is you get an extra hour. Okay, my thoughts on getting inflammation levels checked. It's probably not going to help your insurance do much. This is my thought. We get Courtney and Neil's opinion in a sec. It's not going to help your insurance much. You may get them checked like I did and say it's normal, but you have all this pain everywhere, so it makes you feel invalidated. And like, I'm not hurting. I shouldn't be hurting. My numbers are great, so I should be fine. So apparently my big answer is no. I wouldn't spend the money if it were me.
Neither would I. I don't think it matters. If you feel good, that's all you need to know.
Courtney, what do you think? You agreed? Yeah.
I agree. I don't think it'll do much for you except send you down a rabbit hole if you do have some minor elevations.
Or yeah, and then you get like a little bit of ANA elevation, and then you go to a rheumatologist, and they don't know what diagnosis it is anyway. So then you get a diagnosis of mixed connective tissue disease, and you're like, "What the hell do I do with that?" And they're like, "Well, we don't know." Okay, great. So now I get to be freaked out about this. That sounds good. What did I get diagnosed with in med school? Dense granular platelet disorder. I bleed a lot. I'm like, so what do you do for it? He's like, nothing. Okay. So I'm super glad I know that now. So now I'm just going to get freaked out. Thanks. Hold on. There was an indigestion question. All right. You guys can grab this one. Thoughts on indigestion on GLP-1. Yeah.
And what to help it? Well, first thing before we throw meds at it is I would kind of look at what you're eating. Like, is it a specific time of day that you're getting it? Like, is it every morning, which could be that you're just eating too late at night? A lot of times I recommend a food diary, just so you kind of see like quantities of food that you're eating when you're eating them. Like, oh, I eat way too much before bed. And or is it something specific that you're eating that's causing the indigestion? Some people can't eat red meat on the medications. Some people can't eat cruciferous vegetables. Wonder what those are, like broccoli, cauliflower,
Cabbage.
Those kind of medications that are foods that you used to eat all the time, no problem. But now
Brussels sprouts.
Brussels sprouts, you just can't eat them. So sometimes the food diary will help with that. Otherwise, first step is, if it's just a light, like you wake up in the morning or here and there, I would use like Tums to kind of help put that fire out. If it's kind of more chronic all the time, I would move to Pepcid first.
Yep, she said it happens after red meat.
There you go.
Helpful. Thank you. Yep.
I didn't get to meds.
Whole Foods meatloaf. Man, yeah. I love that, and it kills me. I can't. It'll be literally 18 hours of indigestion. I take omeprazole every day. Besides, sorry, I have new pants on, and they feel kind of like I keep mucking with my pants. I do have pants on. That's the good news, right? Don't forget your pants on Zoom. So this is totally going to get me flagged on TikTok. It's the random comments. It's not the swearing. It's not the like totally overt. We're talking about things. It's the weird. What's the app to figure out how many calories you should eat?
I think there's a bunch of apps out there that do that for you. Typically,
but I think it's crap.
Correct. We don't typically. I think we've talked about this last time, or maybe with our group. It's not so much an amount of total calories that we typically aim for at first. We typically try to focus on protein sources first and aiming for around 100 grams of protein. Because if you hit that goal, more than likely you're not going to have room for a whole lot of other things. The protein is going to help slow down your digestive tract a little bit more, keep you feel fuller longer. And then you don't have to really worry so much about the calories. Now, if you're hitting those numbers and you're like, I'm not losing weight, then I think we look at a total calorie intake. But overall, I think you aim for protein first, your lean cuts of meat, and then add stuff and look at other things.
I agree. And I think hitting your protein, and if you're still not losing weight either on or off of GLP-1, either way, you can track your calories because you know that however many you're eating is too many. And you got to go back from there, regardless of what the app says that, hey, if I eat 1,200 calories a day, I should be losing weight. If you're not, then it's going to take a drop to get that to budge. And that I had to be told the truth when I was in a stall. Even though I thought I was eating very little, it was still too much. It was still too much for the activity that I was doing.
Okay, sorry. I'm looking. I got the lymph node thing. I can't pin comments, and I don't know why. I'm really sorry. Um, my obesity doc focus is exercising more than 250 minutes a week, and I like movement more than exercising, right? Because people are like, I
Yes.
can't work out that much, and I think walking is perfect. Um, and we need to do strength training. um, I use my Fitness Pal. So you're asking for an app. I personally use my Fitness Pal. Some people don't like it. Some people like Lose It or Lose It's the other big one. Any calorie counter. Calorie King used to be pretty good. I've used them all. I do like Carbon. Um, is it still called Carbon? Lane's Lane Norton's. I don't know. He rebrands sometimes because whatever Lane Norton does, trust it because he's amazing. Um, whatever it's branded at. Oh, because it used to be Avatar Nutrition, and then they screwed him over, and he had to go with Carbon. Okay, here we go.
Yeah, it
Yeah.
looks like carbon still.
Okay, good. Yeah. Um, see, squeeze that shit. Make diamond, not coals. Anyway, sorry. You're welcome, Lane. Feel free to use that. Anyhow, complete with snark. He's all about the snark, so that's good. Now, hold on, because Diana Lynn, this is important. Because they found a lymph node that was cancerous. So, Courtney, you were on Saxenda. Lots more side effects than Manjaro from kind of across the board in studies.
Yeah, I wouldn't say that my side effects were higher than Mounjaro. It certainly was not as effective with regards to appetite suppression. It was a bit more difficult for me to keep up with, being that it was a daily injection, and with any travel, like with my Mounjaro, I can kind of plan my injection day around when I'm traveling if I'm taking a quick trip. But the everyday shot, now that being said, if that's what your insurance will cover, I would certainly not toss it out the window. But I did find Mounjaro to be more effective. That being said, I lost, I'd say, 15 pounds on Saxenda. I didn't keep it off when I stopped taking it, but it did work initially. Like most of them,
Right.
they work initially for some weight loss. Now, long term, it may be a bit different, but I wouldn't say it's totally out the window if that's what you can get covered and that's what you can afford.
Yeah, I agree. And as far as the lymph node being cancer, we would need to know, it does cover Manjaro. Now, they cover Manjaro, but do they cover it for only if you have diabetes? That's what you have to call them and ask them. But what that lymph node being cancerous, right? First, do no harm. Was it multiple endocrine neoplasia or medullary thyroid carcinoma? Those don't usually metastasize. Well, men does, but nobody ever talks about that in the media because it's really hard to pronounce. Sorry. But the multiple endocrine neoplasia or medullary thyroid carcinoma does not usually metastasize. And I only remember that. I don't remember a lot of that from med school, but I literally remember thinking if I ever get cancer, that's the one I want because that shit doesn't go anywhere. You just take out your thyroid and you're done. Like, this is how my brain thinks. This is the scary way my brain thinks. Um, so yeah, I would make sure that they cover or what you need to get it covered. Sometimes they'll cover with a prior authorization if you don't have diabetes, if you have X, Y, and Z, or some of them just cover. God bless you. I hope it's the case. Endometrial cancer. That's one of the obesity ones. I'm sorry. I'm sorry we didn't have these drugs sooner. I can't help that. I didn't make them. If I did, I would not be sitting my ass here. I would be like somewhere in a big ass house on a hill. But they said prior auth. So make sure I would call them back and say, if I do the prior authorization, but I do not have a diagnosis of diabetes, or if you do, kudos, it'll cover. Ask them, do I need a diagnosis of diabetes to have it cover with the prior authorization? Because they'll tell you all this bullshit. Oh, sorry. Well, whatever, but they will.
or
So yeah, go ahead.
or if they cover weight loss meds and ask for Zepbound.
Mm-hmm. Yep. Yeah, because if they cover Manjaro, they might cover weight loss meds and ask for Zepbound. When you call them back, say, well, do you cover Manjaro if I don't have diabetes, even with a prior authorization? And they say, well, no, you have to have diabetes and do the prior authorization, which is usually the case. And then say, okay, do you cover Zepbound? And half of them be like, what's Zepbound? Here. Neil, are you on TikTok?
Yeah, I'll
Can
put it
you
in the
put
comments.
Zepbound in the, yeah. That is the new branding of tirzepatide by Eli Lilly that is FDA approved for weight loss. Don't take Motrin, take Advil because it's, yeah, I know, I hear you. It's all the same ibuprofen. But that's the way it works in the US. That's the way it works in the US. It's kind of, whatever. It is what it is.
Candace wrote that she's already lost more on Monjuro in 3 months than she did with Saxenda for 3 years. And
Oh,
we've had
shit.
some people lose some pretty good amounts of weight with Saxenda. Some people it's very effective for, others not so much.
Yeah. Well, it's kind of the same though with semaglutide,
Mhm.
Ozempic, Wegovy, um, compound semaglutide, Rybelsus. Some people just, they don't lose huge amounts of weight, but even in the studies, they didn't lose huge amounts of weight. It's once we added in that GIP synergy to that GLP-1 receptor. Did you post that, Neil, on TikTok?
The Zepbound?
Yeah.
Yeah, yeah, it's
Type
on
it in
there.
the comments. Is it in the
It's
comments?
in there.
I can't see it.
I don't see it. I think we're missing like the last comment. On my
Oh,
scroll.
okay. So it
I added it
takes a
again.
while. All right, fine. Seriously, like I don't see it still. Okay. Did I block you, Neil? Hold on.
Wow, maybe I'm blocked.
Oh, just kidding. I can't find you. Hold on. All right, hold on.
Hmm,
I'm gonna see if I can see my own. This is like our new. Yeah, I can see mine.
super weird.
Okay, Diana Lynn doesn't see it either.
Yeah.
No one sees it from you, Neil. Hold on. We're gonna try to pause live settings. Draw and guest. I can draw things? Oh, that's kind of funny. No, we can play a game. We can I'm not lying. We can play a game where you guess what I'm drawing. It's like what the hell was that called? Taboo? Was that it?
Dictionary. What
Categories.
is it? Categories. Yeah.
Oh my god.
They normally can
Um
see my comments. That's weird.
Normally we can. I know, poor Neil. All right, can you see the comments on TikTok on the live, Neil?
Yeah. Let me
Let's
post.
figure
Maybe I'll
it
post from
out.
my phone and just see.
Hold on. Let me see if I'm just gonna see if we can do this.
Is Zepbound used in conjunction with Mounjaro? No, they are the generic name of both Mounjaro and Zepbound is tirzepatide. In as tirzepatide was first FDA approved for diabetes under the name of Mounjaro, and then when it got approved, now we see yours, Neil. When it got approved, when tirzepatide got approved for weight loss, they rebranded the name and call it Zepbound, but they are the same medication with the same. They are the same generic name medication under different brand names, but both the same dosage, same delivery type in a pen. The color of the label is different and the name is different.
Yeah. I know. I wish I knew enough about TikTok lives to pop up a picture of like Manjaro versus Zepbound. I think I can probably do it on the what dose did you start off with? 2.5. Always go low. You can always go up, can't take it away. Trust me, when you go too high, it is not a good couple of days. Some people end up in the ER because that's what you see in the media where their doctor overdosed them. Or like the pink team today has 2 overdoses on there. I don't know if you've hopped on. I don't know if it's your day, Courtney, but I hopped on. There are 2 overdoses on that priority sheet today.
I will get on there shortly.
I'm like,
It's okay.
guys,
I need to not touch it.
don't touch it. Don't touch it. It's my job to look and be annoyed.
Not my job. I have to take a day off.
Yes, yes. I actually took almost, well, okay. I was going to say, I almost took the whole day off yesterday. I took half a day off yesterday. Can I stay on that dose? I stayed on that dose for 3.5 months and lost, oh, what was it, Neil? Help me. Like
30?
30,
We're around 30?
30, 35 pounds on 2.5. And I tried to go up to 5 too early. thought I was gonna die. I mean, it was like my heart rate was it was just horrible. My heart rate was dropping. I'm like texting Neil, I'm on vacation, like, holy shit, I'm gonna die. Um, what am I gonna do? He's like, nothing. Like, stay hydrated. There's nothing you can do. But that's the just easy. You know, you can always go up, but it's tough to take it back.
Yes.
I think it's important to note that we have yet to find in all of the patients that we have, there is no correlation between how much weight you have to lose, male, female, any other basis to help us determine a dose that would be effective for you. We have some really large guys who, can hardly tolerate 2.5 milligrams, and then we have some really tiny ladies who need to go all the way up to 15 milligrams and stay there for a while before they notice any appetite suppression. There is no rhyme or reason. So we can't say, oh, you need to lose a lot of weight, we got to start you at a higher dose. We can't. There's no way to determine what your dose is going to be. So we start low because it's much safer.
I want to pin Lee Ride's comment. Yeah, hold on and enjoy the ride. Yep,
Right?
that was exactly it.
It's gonna be a couple days before you feel better.
It was horrible. It was out, and I was on vacation. I thought I'll be fine. I'll be fine. Famous last friggin' words there. When would be a good time to switch from Wegovy to Zepbound? Not losing much. I think my opinion on that is as soon as you can afford it. But if you're paying with the savings card, Zepbound is cheaper than Wegovy anyway. So because with Wegovy is like 800, I think, with the savings card, and then Zepbound's 550. And if you're on compound, yes, it's more expensive. So as soon as you can swing it.
But if your insurance covers Wegovy and not Zepbound, I would go with the Wegovy until you're maxed out and it's not working. Is what I would do. Because it
Yeah,
might just be
same.
because like the big doses for some people are like 1.7 and 2.4, and they don't lose a thing until they get there.
Yeah, and a lot of people are afraid to go up on the higher doses of Wegovy, but the weight loss doses are not in the studies until 1.7 and 2.4. And I thought they were going to increase that, but I guess not. Yeah, I had more appetite suppression with 0.25 on Ozempic, but now I'm at 0.5 and hungry often. So kudos that you actually got some suppression on 0.25. Not a lot of people do. But yes, I noticed some attenuation where like I was on 2.5 for 3 months, and then it was like, yep, hungry, kind of a lot. And that's when I went up. And that's kind of how we tell our patients to go up. I'm gonna shut up so you guys can add to that.
No, I would do the same thing. Like if 0.5 is not working, go up to 1. It's time to move up.
Yep.
Unless it's that strange phenomena that we've seen in a few people where they have great appetite suppression, they're rocking along and they're like, I'm feeling good, maybe I can go up. We bump them up to the next dose, and all of a sudden their appetite suppression is gone, and then we go back down to that previous dose and they rock it just fine. It's weird.
That was like the Monjuro 7.5 to 10.
Yes. Yeah. The 7.5 to 10 is like the weird spot where some people don't do a bit on 10.
Yeah.
But 7.5, they're like, I get a ton of appetite suppression. I mean, we can't predict that. Like, there's no way.
No way, and it doesn't make sense.
No, not at all. It's like, granted, though, you think about it this way, like with the hypothalamic pituitary axis, right? Your brain's involved in hormone production. Your gut has a crap ton of hormone receptors. So the feedback loops, like we don't know, like we can take tests. So it's actually, this is a good example on, getting your inflammatory markers checked. It's almost like getting hormone levels checked. We can take an instantaneous blood sample, but it doesn't, unless your thyroid's way out of whack, then that's easy, right? But it doesn't show the interactions between your brain, your gut, your hormones. Like it just doesn't do it. So it's so dynamic. We are not a closed system. We are a biological system, not a strict chemical system. And we try to put it in these boxes, right? Just like insurance. If your BMI is X, Y, and Z, but if you got a life run by food and you're crazy in your brain, you don't qualify, right? So we do the best we can with the systems and tests we have, but your body's and here's the thing. If I'm super stressed out, I'm going to eat more and it makes my appetite skyrocket. Well, that's thoughts, right? That is thoughts directly affecting my adrenal glands aren't tired. Trust me, they're working just fine. They're cortisoling myself to death. But it's your thoughts affecting your body. So that's why we talk about sleep and we talk about stress and we talk about getting in the protein in the morning. These are the big rocks. Getting some movement in, preferably some heavy lifting with Metallica. Just kidding. Just depends on the day. That will decrease your stress. And I'm missing one. Is hydration one of them? Yes, hydration with electrolytes.
Hydration. We added in movement as our fifth.
Yeah.
And diet quality. Did we talk about
Oh,
quality?
we don't. We don't want to talk about diet quality. We want the chocolate.
It matters. I hate it, but it matters.
Yeah, I hate it too. If I eat chocolate, I can eat 3 times as many calories, no problem. Easy. I can overeat this drug like I'm not even taking it.
If it's good chocolate.
Nope. Don't even, nope. Because I can't binge on good chocolate, really.
I will bring you dollar store chocolate and you will not eat it.
Well, okay, the dollar store chocolate is only in emergencies only. Like that's just straight up. I need the sugar. Leave me alone. I'm getting my drug. Um, but but Hershey's chocolate is like plain old
Good enough.
good enough. Yep. Right. Like that hits the spot. Thank you. Have I ever heard of using spearmint tea to help with androgen levels? I have not. I don't know where that fits in that whole hypothalamic pituitary axis. And I'm
Elise asked if all doses of Zepbound were around the same price with the savings card. Yes. Brand name medication, all doses are the same price across the board on those GLP-1s.
the disclaimer with the savings card is you have to have non-government commercial insurance that does not cover. If it does cover, it's cheaper. But you have to have non-government insurance. You have to have insurance. Cash pay patients don't get that luxury because they're getting Eli Lilly gets their money from the insurance companies. I'm sure that's making them real happy. But it's the system has to change. I
No, but
think
if
we
you're
can change that by 2:00.
yeah.
Sorry.
And if you're going to pay $500 for like a starting dose of Zepbound, if you don't mind it, I would go compounded route. It's going to be tremendously cheaper. And then when you get to the higher doses, switch to playing for the brand name because then it makes sense.
Yeah, because our compounded prices are what, like 240 for tirzepatide in most states, I think.
I think for like 5 milligrams or something like that is where it's
Start.
starting or something. Yeah.
Yeah. Oh, yeah, because it's like 5 milligrams, it's like 240. So it's like right around 200 for compounded with the pharmacies we use. And we will still be looking for other pharmacies in the future, but right now we're doing okay.
Yeah, and both of the ones we primarily use just kind of lowered the price a little bit. So, which is great news.
So Federal Blue Cross insurance. I think you can use the savings card because it's a federal, it's not Medicare or Medicaid. I think because it's a commercial plan offered by a federal organization. We have lots of government employees in Florida. They got the best friggin' insurance going. What the frig is up with that? I know. I'm like, everything's covered under that shit, which is so weird out of a government thing. I think Federal Blue Cross should right? Famous last words right there. You should be fine.
Yeah.
Staying on Wegovy, moving up to 2.4. Hold on. My doc won't prescribe Manjaro since my BMI is 23.
Sorry.
I almost said it.
What, find a new doctor?
No, it was worse. It was worse. It was like it was a personal attack on this person I don't know.
He just doesn't know the medicines like we do. You know?
True that. Thank you.
At some point, they'll get educated. I don't think they're going to have a choice. More and more of their patients are going to be coming to them that are obese for this to prevent them from having heart attacks and strokes and getting diabetes. So,
yeah, that's very frustrating, and I'm sorry. It is very frustrating, Jamie. Obesity is a chronic, remitting, relapsing disease. Food noise is real, and I really hope that somewhere along the line, even the DSM-5 or 6 by then probably would characterize because binge eating disorder is already in there. But what if you are not binge eating or you are in remission from binge eating, but you still have a crap ton of food noise, hence Hershey's chocolate, right? Let's be real. Um, but and I actually don't have a lot of food noise today. That's just a bit of reminiscent. Um, but even though your BMI is 23, it doesn't mean you don't have the underlying mechanisms. If you go off, studies show that most people will regain. So does your doctor want you to regain, get obese again? Because that sounds like a great time. And then, oh yeah, then I'll put you back on. But then I'm going to take you back off because you're not fat anymore. Well, when your blood pressure is under control on lisinopril, do they take you off the lisinopril if you've made no other changes? No, because your blood pressure is under control. That's the whole point. These are chronic, relapsing diseases. Period.
So there's a couple of questions about working with us. Yeah, I typed in the comments. I don't know if you can see it. Go to amstelehealth.com. You can kind of see all our faces. You can see my face there since you can't see it here. Learn a little bit about us.
Give
And
me some love.
if you want to join us, click that become a patient button and fill out the email, and we will get you started. It says all of our states on there, which can Dr. Moe remember them?
Yeah. Oh, and Lori said, my 23-year-old daughter wants to start Zepbound. Best route for her. Come to us if you're in our states. Ready? Our states are, I think there's 11 of them, right? Are there 11? Hold on. Alabama, Arizona, Florida, Michigan, Miami. Just kidding. New York. Oh, did I say Ohio already? Ohio, Wisconsin, Texas, Virginia, Tennessee. That's 10. Are there 10?
I think Louisiana.
Indiana. I forgot Indiana.
Indiana.
There's 11.
Every time.
We would
And
say
if
the
you're
best route for her is come see us.
Yeah, and if you're not in one of our states, we can. If you click, I think it's below there. Nikki Baldwin can help you out. She's in, I think, all 50.
All 50
No.
states in DC. Yep, she's got 51 state licenses because, the government likes to do that fun shit. Can you use the savings card if your insurance is denying? Yes, that's the beauty of the savings card is if your insurance covers it, it brings your copay down to as low as $25. That's that bait and switch at the top, the big 25. And then if you look in the fine print, you're like, what the hell happened? I just got charged $550.
Mm-hmm.
If you get charged $550, it's because you have insurance coverage, but your insurance does not cover it. Yeah, and I need to figure that out with HEB because I want to try to get the 7.5s, and which was so weird. Neil, you prescribed it.
Yeah.
And HEB says they are contacting you for refills. I'm like, I didn't get a first fill, people. Like, I don't know what we're talking about here. So I just have to go in there and I'll find Ben, the tech that I like. Be like, okay, here's the deal. I'm doing the savings card. I want the 7.5. Can I have it, please?
Oh, then yes. And if you're in Massachusetts, you can go see Mindy.
Yes, you can see
She's
Mindy.
posted up on our Facebook.
Thank you. Oh my God, I didn't even put the chat. I didn't put the chat up. Jesus. Look at, see, there goes my AI camera. Up here. It's up here. There we go. And we're back. Oh my God. Whatever. I have an AI camera that follows my head. So when I slouch, yes, go see Mindy in Massachusetts.
That's
it. She is on guidancehealthnow.com for those of you on TikTok, because you can't see the Facebook comment here. I pay $5.95 for compound. Oh, damn. Do the damn savings card. You're paying $600. Well, that's because that's what we do. At the higher doses, it costs $60. So it's like for 60 milligrams of tirzepatide, it's like $610 or something with our pharmacies.
Yeah.
So that's what we tell people. Just go to the regular pharmacy unless they don't have insurance and they got to do self-pay. But we're not saying, oh, we make more money if you do compounded, so come with us. We're like, what's the cheapest way for you to get this shit done? I'm so unorthodox. It is what it is. I'm like, all right. Oh, hi, Jenna. We can use the savings card with Federal Blue Cross Blue Shield, so thank you. BMI 27 or above, right? That's a tough question because kind of like we were talking about, I don't have I love that. Sorry. Thank you. I did you see it on TikTok, Neil?
Which
I had a
one?
heart on my head. I had a heart on my head.
Oh, I did not.
I
I was
know,
reading
right?
comments.
Like, look. Anyhow, then I got distracted. See? What was I talking about? Oh yeah, the BMI of 27. Yeah. Somebody else hit that question because I'm talking too much.
Yeah, so depending on your insurance, some require you to have a BMI of 27 or greater, along with a comorbidity like high blood pressure, high cholesterol. Like you have to have something else, and then they'll cover it. Otherwise, it needs to be typically 30 and above. So typically in that technical obese category.
That being said, we will prescribe it if your BMI is low. Like those are two separate things. We've got
Yeah.
insurance coverage and then we've got us prescribing it. We will prescribe it. Like my BMI, I think is like 22, 21, 22. It's a little higher than I'm comfy. My joints ache a little bit, but whatever.
But we also, when we prescribe it at that BMI, it's for other reasons. Typically, that's a conversation we have. Either you're on maintenance and we're trying to keep it there, or there's other issues why we're trying to keep it there. We're not there to put you in a size 0.
Yeah, no. And we're not there. I saw this article yesterday about people over 65 getting ready for like their grandson's graduation. I'm like, can we please stop pigeonholing people? Like, how many of our people over 65 are doing this for an event? They're doing it so they can play. And they did mention this, of course, but it's not in the headline in the article that they just want to be able to be active and play with their grandkids and maybe reduce their risk of heart attack. Maybe that. Like, why does the media keep harping on this? If it's not a prom dress, now it's a grandson's graduation.
I think over all the patients we've taken care of, there's like one that I found out later that that's what their goal was. Otherwise, I think everybody else is, really just trying to get healthy. Like they want to lose weight, of course, but they're trying to get healthier.
Or they have food noise and they live a life
Yeah.
run by food, which sucks. Speaking of which, Lavatree said, Manjaro 5, 7 weeks, no appetite suppression, still food noise, lost 8 pounds, but I'm eating healthy. If he has a food noise, I say go up.
Yep.
It's a mental health drug. I'm sorry. Like I need some freaking relief, people.
Time to go up. Courtney didn't have much relief until 7.5, so that might just be your number. Might be a little higher.
Yeah. Someone asked about Medicare coverage and what we've heard about Medicare coverage. So last year in 2023, there were a lot of Medicare supplement plans that covered Mounjaro and Ozempic without a prior authorization. The bulk of those have switched to 2024 needing a prior authorization and will only cover with a diagnosis of type 2 diabetes. Medicare declared years ago that weight loss or obesity is a cosmetic disease and they will not cover cosmetic conditions. So the chances of Medicare covering things that are for weight loss is zilch at this point until some big things in Medicare change. That is what we have heard about Medicare coverage for weight loss medications. It's a sad state.
Yep. And the thing is too, I mean, do we really think, I don't expect my insurance to pay for my breast augmentation. Okay. Sorry, Dad, in advance. But I don't, or again, not in advance. I don't expect my insurance to pay for that, right? That is a strictly cosmetic. Now, funny thing was, it ended up not being as cosmetic as I thought. I mean, yeah, I look different. That's fine. Nobody else cared. I mean, it was all for me. And it changed the way I saw myself. And it changed. So here's the weirdest thing that happened. Not that you guys need, whatever. You get me. You get the real me. The weirdest thing that happened is I felt more like a mom than I ever felt because my kid was little. And it was the weirdest friggin' thing. I did not see that coming. Kind of like when I had to have a hysterectomy urgently and I felt like a loss of womanhood. And I was like, wasn't using it. I don't want it. I didn't see that coming. It's just weird. The things that I don't know. I didn't see it coming. I expected to be like, take the uterus, put it in a jar. I don't need it. But it was just, that was a weird loss for me. And getting bigger boobs was wow, this is what people feel like, but it's almost like with the food noise, right? So the food noise goes away and you're like, this is what people felt like they can just exist. I'm like, this is what it's like to have boobs. Nice. But I don't expect insurance to cover that, right? but in retrospect, it's better for my mental health, so I'll go with it. But that's cosmetic. Did I need them? No. But did it help my psyche? Yeah, arguably yes. The food noise, it's not just the food noise. The food noise, it's making me more productive. It helps me do a lot of other things, but it helps my cardiovascular status. It helps my joints. It helps my inflammation. It allows me to make better food choices. Those are health concerns. That is not cosmetic. Yes, I fit in smaller size clothes. Yes, I fit in car seats better, airplane seats better. Um, but that's not, this isn't cosmetic. I got enough saggy things. This is not cosmetic. Not the boobs. Waiting for a PA from the doctor. Can I use the savings card for a month just to start till approval? Absolutely. Get that shit prescribed and go.
Yeah.
With
Cosmetic and disease don't belong in the same sentence. That's a hell of a point.
True.
for Britt Malcolm, for compounded semaglutide, what dose is after 1.7? It kind of depends on how you're doing on that dose. Because some, like technically the weight loss dose, the next one would be 2.4 milligrams. You could move like Jenna says to 2. You know, if you're having like effect for like 5-6 days, you can try to go to 2 first before you go to 2.4. It's kind of up to you. That's the great thing about compounded.
Right? Yeah, compound you
Ooh,
can go up.
here's a good question. This is your question. Do you have an opinion on Monjuro versus Ozempic? No, she
Do
has
I have
no opinion
I have
whatsoever.
no opinion on that whatsoever. These guys know me way too well. I am team terzepatide. I should wear a shirt that says I support team terzepatide, which is Manjaro or Zepbound. Watch Retatrutide be even better. I'm kind of excited. Um, I know, right? Like, get it out there. Come on. No, I think, and I've never, see, here's the thing. I have never taken semaglutide, but I won't because tirzepatide has been so good to me and changed everything for me. Like, it changed my life. I just asked AMS to change from semaglutide to tirzepatide. Um, I think it's worth it, especially like so we see a lot more diarrhea side effects that happen a lot less. Not a lot. Okay, I'm exaggerating, right? If I've told you once, I've told you a million times. Stop exaggerating. We do see, I would say, less like diarrhea side effects with tirzepatide than semaglutide. We see just better like all over food noise reduction. Yeah, I was on tirzepatide last year, did well. Semaglutide's not doing anything for me. We see it pretty often.
Yeah, overall, Monjuro tirzepatide Zepbound is the stronger drug, and you know, for most people and in the studies, I've never seen someone not respond to tirzepatide, but I've only seen one person not respond to semaglutide. Sometimes when you switch, like you know, back to the other one, it takes some time for it to build up in your system and get to a dose that's appropriate for you. So it, you know, it might not be the first month that you feel that there's anything for you. It might not be the second month as we're kind of increasing.
Yeah, agreed. Yep, and thanks on that. Thanks for that comment. The half life of the med is 5 days, so we usually tell people to like Monday morning. So yeah, I do my injection on Monday. Tuesday is nausea day. Sometimes not. And then Sunday I can usually eat whatever the hell I want and whatever the hell's in the pantry. Anything I can get my hands on. If now, see, here's the problem too. My kids home on Sundays and we often make cinnamon rolls or pancakes. And as Neil will tell you, if you don't start your day with protein, I know. It just primes that pump. It's the donut phenomenon, which was the funniest commercial last night and the only funny commercial, in my opinion.
Which one?
Did you see the Ben Affleck one with Dunkin' Donuts and
Oh
Matt
yeah,
Damon?
I like Donald Schwarzenegger one.
Did you?
I
I mean, it was
did.
okay, but it was kind of cute. It was kind of cute, yeah.
And I was glad they left the Carl Weathers one in. They
Oh
were talking
yeah,
about getting taking that one out. So
yeah. The Google AI one with the vision impaired person.
that was pretty cool.
I was bawling. I was bawling. I mean, it wasn't funny, but I was literally crying by the end. I don't know if you guys happen to see. I was like the State Farm commercial. Yes, fine, fine, fine. Yes, it was cute.
Hair Joseph
Neva.
is asking, does it make your heart rate go up if you're tacky?
So, you know what? One of my friends and patients stopped because her heart rate during workouts was super high, even hydrating and doing the things. Um, but in the studies and in myself for 6 months or so, it bumps it up 10 beats per minute.
Yeah.
And then it calms down after 6 months, which mine did. I think mine's still like 5 beats higher per minute. Um, Usually, if we get you hydrated with electrolytes, it'll fix the super tachy. Now, the thing is, if you're getting super tachycardic from a medication, you need to figure out what the hell's going on from a cardiologist, right? Like, not just, I haven't had palpitations in like 5 days, 6 days. Shit. Anyway, sorry. That's because when I don't get them, I don't think about it. I don't think I tracked it. It's February 12th. I haven't had
Oh,
them probably since about 10 days. Hmm,
awesome.
50. I'm going to go
Another
with it.
another question up there. I have a prescription for Wegovy, but no pharmacies around here have it.
No pharmacies, period, have it.
Yeah. If you find some weird Bob's pharmacy in the middle of nowhere where there's no population, maybe they have it. But yeah, the lower doses you're just not going to find. What we have done with our patients that like it gets approved is to start them on the compounded version until we get to a dose that is available for them. So it can be as low as one. Some people are able to get. Otherwise, it's like 1.7 and 2.4.
Okay, so there is an update from Novo Nordisk. We are
Ooh.
enabling more new US patients to initiate treatment by more than doubling the amount of the lower dose strengths of Wegovy into the US market beginning in January of 2024, while gradually increasing overall supply throughout the rest of the year. We expect it'll take a couple of weeks for products to arrive in pharmacies.
I think you froze on me.
So I got all excited about that,
But
except
but double zero is still zero.
double zero is still zero.
Yes.
Bob's has one. Now they have two. However, it is important to be aware that overall demand will continue to exceed supply. Whose problem is that? Um, which means that some patients will still have difficulty filling Wegovy prescriptions. Feel free to go get Zepbound for $5.50. I swear. You know what? I think I'm selling my Bitcoin. Don't ask. I got this teeny little account that I just play with. I'm selling Bitcoin and buying Eli Lilly.
Good idea.
They said the same thing about Wegovy in September. Mm-hmm. It was supposed to be done by September. They were supposed to, whatever. But then they failed inspection on their plant, so that hindered things a bit.
They've been
I just think they had a
advertising
poor.
doses for, oh my gosh, approaching 2 years now.
Mm-hmm. What'd you say, Neil?
It's just a poor. They had a poor plan. They either didn't think people would pay for these medications, or I don't know what their plan was, but it was terrible.
No, it's in Black Widow, where Yelena Belova, what's your plan? That was my plan. Your plan sucks. When are they releasing Retatrutide? Not soon enough. I want to try it.
I can't wait. I can't wait to the study. All the research is out.
I know.
The
I
initial stuff
know.
is unbelievable.
I know.
Any
Uh,
tips to prevent potential hair loss? Should one slow down weight loss or take a vitamin?
uh,
Hmm.
Protein, vitamins, biotin, but it's going to happen with
mhm.
any weight loss or calorie deficit. You're going to
Or
have hair
stress.
loss. It lasts for a few months. It stops. It slows down. You regrow your hair. It's
I realized that because I've been at goal weight. I was looking in a magnifying mirror, my makeup mirror yesterday. I was like, damn it, my hair is still pretty thin. And then I looked and I saw I still have hairs growing in a year into maintenance. It's a 13 months now into maintenance, and I still have hair regrowing, but I lost about half of it. Is there anything? What is Retatrutide? Um, oh my God, looking into 2026. Oh,
That's
sorry. Is that for Retatrutide or Novo Nordisk getting their ass in gear? Both.
probably
Um,
both.
Retatrutide has a third receptor agonist. So it's GLP-1 GIP, and glucagon. Am I right?
Yep.
Yeah. Sorry. Trust yourself. Trust yourself. Yes, you're right. You know this shit.
Yeah, we just
Um,
haven't talked about it in a while because
we
hasn't been making
I
news.
know. It got stalled, so we stopped talking about it a lot. But God, I want it. Anything special that has to happen when switching from compound semaglutide to tirzepatide, start low. You can go up fast, just start low.
Yeah.
And hydrate like hell and be prepared for amazing success. I'm such a nerd. Um, hold on. The arrhythmia question. I missed it. Thoughts on arrhythmia and seen in the studies with retatrutide? Well, the glucagon is the vagal nerve thing, but I didn't see. I thought there was. I looked at it. Hold on. I need to look at the study again though because I haven't looked at it lately.
While you're looking that up, I'm just going to take this.
Yep.
Evangeline, my doctors keep me on 2.5 Zepbound for another month, and I'm worried I won't lose weight. Well, I guess it kind of depends. So, if you went and saw him and you were having side effects, maybe that's why he kept you down. It's possible he doesn't feel comfortable, and that's why he kept you down. But if you're having good appetite suppression all week long, it's hard to tell you when that's going to stop. You might be able to go another month or two on 2.5 milligrams if you have appetite control. Like Dr. Moe, I think was several months on 2.5 before she had to go up. So that you might luck out and be able to stay low a real long time.
They got the, hold on, they got the side effect though for retatrutide. I'm in the wrong study, but I got sidetracked. Cutaneous hyperesthesia and skin sensitivity were 7% of participants in the retatrutide group versus placebo group. They finally did it in there. But I'm telling you, if you have this, make sure you get something with potassium in it. I don't know why it works. It's not a lot of potassium, but it's gut intake of potassium, not like, pills or supplements. It's coconut water. So it's probably something with the glucose and the potassium and the transport mechanism is my guess. And I did go to school. But that, okay. So this is helpful. 9% of participants in the retatrutide group developed cardiac arrhythmia versus 2 out of 70. So 3% in the placebo group. There was no consistent pattern of arrhythmia type. And some of these events were reported as palpitations or increased heart rate without further detail.
Could be
So
related to blood sugar
and hydration
hormones.
because hormones, yep, resetting because your body's like, woo, we are redoing a lot of things. So because it wasn't like, oh, everybody gets AFib, that's a friggin' problem.
Yeah.
And my palpitations actually, my heart rate was higher. So like it was pound. Now when I was too high on too high of a dose, holy bejesus, I would have these vagal responses. My heart rate would go from 120 to 50. That was too high of a dose. So maybe because it's so effective, they need to start lower. They need to actually go way lower than they think because they keep thinking people can handle, people can start with 5. No, they can't. It feels like shit. And you're going to knock people out and they won't be able to continue therapy. Like I think we talked about her last week. I have a friend who she was on 2.5 of tirzepatide, wicked stomach pain, eating way too much in the cruciferous vegetable category, as it were. But she went to the ER like 3 times thinking it was pancreatitis. Well, it wasn't. It was broccoli.
Speaking of pancreatitis.
All right. Yeah, we can address that too.
Yeah.
So anyhow, so we have her back on 1.25 now. She's doing great. She feels fantastic. And she had a ton of food noise. Like she needed to be on this drug. It was like, it was taking over her life, And she's fine. She's good. She's like, should I move up? No, not right now. We're going to stay on that for a really long time. But we had to start her lower at like a dose she could have gotten from a Zepbound pen. So.
Someone on there asked, I think that's what Neil was referring to, that they've had pancreatitis and have a prescription for Ozempic. Should they worry? I think we would ask, if known, what was the cause of the pancreatitis? Was it gallstone-related pancreatitis and you've had your gallbladder removed now? Was it related to a bout of drinking alcohol? If it was idiopathic pancreatitis and there is no known cause, no real relation to anything in particular, yeah, that's probably a concern.
Courtney, you can't see this wave video. I can click um I can click comments to show on the screen from the chat.
Yeah, I was wondering how
And
you did that. I'm like, where did that come from?
look on Neil's face like, so I said, you guys are the best. I popped that on the screen. We're going to pat ourselves in the back a little bit.
Let me keep going on Kathleen. So, in the studies with the medications, the number of people that got pancreatitis in each group was the same. So, that includes the placebo group. People who didn't get any medicine at all, still one person developed pancreatitis. So, the risk is extremely low in developing pancreatitis. There is a transient increase in lipase sometimes. Um, was it the endocrinologist? I read a study where they were still recommending to start patients on the medications if they've had pancreatitis because the benefits outweigh the risk, and they're just not seeing these cases of pancreatitis, especially with like Byetta and the other ones. They've been out for 17 years, and we're not seeing it. So
Mm-mm.
myself,
Well,
I would not worry.
and an increase in lipase does not mean you have pancreatitis. So it's
Yeah,
a
it's just a transient slight increase, not to the point where I'd say you have an inflamed pancreas.
so hold on, let me make sure I can get it on both cameras. There we go. Yes, I have two cameras going. Hence why I'm looking in like La La Land for part of it. I drink Body Armor Light. I started with coconut water because I didn't have I had a lot of caloric room at the time. Like I was eating when I first started, um my appetite suppression was so profound that I could I mean, it didn't matter what I was eating, I could only get in like 800 calories a day for a little while. That ship has sailed. um and yeah, starve mode doesn't exist, so we'll just shut that down right now. Now I was not lifting either and not getting enough protein in, but that was my choice. That was stupid. I just worry about since I do have AFib. I did want to address this one. I think a couple of things. It depends how your AFib is controlled because you may have to change your antiarrhythmic medications with, well, you know this, but I'm going to say it anyway for the rest of people out there because it will slow down your gut so much and that vagal response with because AFib's not a vagal, it's exacerbated by vagal concerns. So with glucagon being a vagal activator, you we may have to like not we it's not me and the mouse in your pocket, you and your doctor might have to figure out how that AFib what that AFib control looks like in conjunction with that medication. But I don't think the medication itself would be an independent risk factor. But yes, I'm drinking Body Armor Light, and I used to drink a lot of coconut water. Yeah, Kathleen said liquid diet, large weight loss, and did have her gallbladder removed. So yeah, if it was gallstone pancreatitis, Maribel Campos, who's in California, by the way, as a provider, uh, we talked a lot through that because she had gallstone pancreatitis, and she's like, "Do I go back on it? I can't. I'm horrible without it. Like my brain's a mess." I'm like, "Go back on." She's fine. She's fine. I have not talked to her in a while though, so I'll have to
Oh,
send
let
her.
me add this. Since we're
Yeah.
talking about pancreatitis, with our patients, I think we've had 4 now that have developed pancreatitis, 3 or
Okay.
4. It has not been that many. All of them, the same thing they had in common is they drink way more alcohol than they told us. It wasn't like a glass of wine here and there. It was
I'm a
a,
social drinker.
it was an everyday drinker, and then heavy sometimes is the ones that have developed pancreatitis.
Yep. It's alcohol has been the consistent. I've only had 2 instances of AFib on a blood thinner, no antiarrhythmic meds. Okay, so it's paroxysmal. Um, I wouldn't I wouldn't worry about it. Watch the blood thinner with the retatrutide because we don't know about absorption. But um, hold on, Texas Beard. I'm sorry, Texas, Mr. Beard. At least I think you're male. Just kidding. Sorry, that was horrible, but hilarious in my brain. I meant to say hi when you popped on, and I didn't. Um, hold on. Yes, I agree with that. Stay on the meds. Just started Zepbound on Saturday. Woo! And no side effects. Fantastic. Oh yeah. Can I speak to the fact that people likely have gallbladder issues prior to starting the meds? So, what gives you gallstones? Being fat. What gives you more gallstones? Getting skinny. Okay. Like shit, we're screwed. And being female and 40 and pregnant, but you're not on these meds pregnant. So you're kind of screwed. If you have a gallbladder and you got any extra fat, guess what goes into those gallstones? Sucks. I missed one that I was thinking about, but I can't. Has anyone ever stopped and then started all over? Yeah, lots of them.
Yep.
Yeah, lots of people, and it kind of depends on how long you've been off. Is where you need to start. At least with us, where we start you back off. Like if you were at 15 and you've been off for 3 weeks, we're not starting you back 2.5. We'll likely start you a little higher. And if it's compounded, we can go up pretty quickly to get you back to where your appetite's suppressed.
But we would not start right back at 15.
No. We slowly go up.
And Texas Beard was asking about bariatric surgery and tirzepatide, brand name or compound. Yes, in our practice, we do have several patients who have had bariatric surgery in one form or another. The neat thing about tirzepatide is it targets the brain that other things just don't. And it really, in our experience, solves a lot of problems that simply suppressing the appetite or not allowing the stomach to fill up doesn't do. Dr. Moe and I could both eat a lot when we're not hungry. So just controlling the appetite does not always do the trick.
Yeah, if I only ate when I was hungry, we wouldn't be in this mess. If I could stop when I was full and ate when I was hungry, like, would not happen. Baxter, headaches for the first 48 hours. Start here. Start with hydration with electrolytes, not free water. Free water does not mean it doesn't cost you anything. It means there's no electrolytes in it. People will say, I drink like 2 gallons of water a day. Great. You're going to have seizures. Don't do that. Add a pinch of
Salt the hell
salt.
out of your food.
Neil said, I hope you're salting the hell out of your food. Because that's really that's a problem. It's like, so when people have seizures in endurance events, it is because their sodium drops too low because they're drinking too much water without electrolytes. If you're in a hot event like Ironman Texas, a little less hot now that it's in April instead of May. But when I was in better shape and was completing the whole event, I would actually take salt capsules of 1 gram per hour. So that gives you that. And I'm not a heavy sweater, not the Christmas kind. But I am not a heavy sweater. And that was 1 gram per hour. So, just a heads up.
Yeah, to give you some perspective, people drink pickle juice while they're on the bike and the run and stuff like that because they need that's a ton of salt. That's what they need.
Yep. Oh, Britt, I know. Yeah, it's okay. Don't be scared. Team tirzepatide. I'm telling you, you're going to be like, what the frig was I doing? Any electrolytes. So we have people who like Body Armor. We have people who like Liquid IV. At the very least, a pinch of salt in your water. Like if you're like, I really got to save money because I'm spending money on the compound, whatever. You don't have to buy, because these things are expensive. Like the electrolyte things are expensive. Even like the Publix passion fruit ones, which are the only ones that I like to travel with in packet form. They're kind of like Liquid IV. Maybe Liquid IV would work too. I didn't like it though as much, but there's a ton of electrolyte drinks out there. I don't really have a preference necessarily, just something. I mean, there are optimal levels. Don't get me wrong. It's not like, oh, any electrolytes are fine. It's that big rocks first. Pick one that you can tolerate the taste and will drink and can afford. Yep. All right. Oh, we're losing Neil's video in 47 seconds, but we'll still have his audio for those of you on TikTok for a little bit. But yeah, okay, good. I think we caught up on comments.
Just the one comment over on Facebook with Joy. She's been really bad with the protein lately. She made a conscious decision to really focus on the protein over the weekend, and she's down a little bit to the 1.5 pounds. So
perfect.
Yeah,
absolutely perfect. I mean,
that's all it takes.
Yeah. I mean, really, It is the big rocks. It really is. Um, certain type of salt to use. Neil, this is you.
I like Celtic, Celtic, Celtic.